Excellent. Right. So before we begin, let's just start off with this a little bit of our introduction. So, who is Construction Health and Wellbeing Limited? So, we're a health, hygiene, and wellbeing consultancy that has dedicated to the construction industry and really believes in that we can create a healthy and happy future for the industry. I'm Jennie. I'm the founder. I've spent the last 13 years in construction and just coming up to 20 years in nursing, which still shocks me now when I think about how quickly that time has gone. And I'm really pleased today to be joined by Wendy Jones. So Wendy has a doctorate in ergonomics and she's done research on several construction projects. And before that, she worked as an occupational health nurse for 20 years. So she's seen the impact of work-related stress from all sides. So today's session, we're going to look at the process for undertaking stress risk assessments, and we're looking at it from an organisational level, so not specifically from an individual level. And we're going to talk about things from a construction industry and use our expertise around that, but actually this process is relevant for whatever industry you work in. And I know there's some people here that aren't from the construction industry, so I'm sure you'll still find it fairly useful. Towards the end, we are going to touch a little bit about solutions for stress risk management, but I think probably all of you will recognise that could be a very long webinar if we went through lots of that in detail. So we're not going to go into too much detail, but we're going to send some resources out afterwards to help you to manage that as you go forward. So let's get started. So I'm going to hand over to Wendy. Hopefully, oh, not just yet, Wendy. Sorry, Wendy, it's me next again. So let's get started. So let's talk about how we've got to this point around in construction. I think many of you are probably on the call can relate to how important mental health has been in construction industry, but many industries, and it's been high up the agenda. And we're not quite there with safety. We're still seeing that parity focus greater on stress, on safety, and there's been some great work done. There's been some work with the Mates in Mind, the Lighthouse Club, and I don't know for yourselves, but for me there's definitely been one piece of the puzzle that's been missing, and that is about the prevention space and looking exactly what we're talking about today. How do we make sure that we prevent work-related stress risks? So we know we have a legal duty to do something, and we know we have a moral duty to do, and we know that we spend, probably in most organisations, spend lots of money, probably thousands of pounds on training people up in mental health first aid, campaigns and initiatives. And I know we did a poll recently on LinkedIn to say, how many people are finding that they need some support, and how have they evaluated their stress risk assessments? And 63% of people have said that they know that they need improving. And it asks us the question: we know as an industry we're so used to that risk management process. Why is stress risk management any different? So now I'll hand over to Wendy. Wendy, I'll let you take it up from here.
Okay, thanks, Jenny. Good afternoon, everybody. So it's not surprising that stress is a tricky issue in construction, because if you work in it, you'll know the way the sector works. It is really fragmented. You've got the workforce spread all the way down along the supply chain. We've got very high levels of self-employment. It's one of the highest self-employment levels for industries in the UK. Job insecurity, late payment, short-term contracts. We've got a lot of the workforce who are either got long commutes or they're living away from their families. There's pressure to complete work on time within budget, and there's traditionally quite a macho culture in the industry. So there's a lot going on, and I think that can make us feel a little bit defeated. It just feels a bit like it's just too difficult. And the message that we get is, well, that's the way the industry is, just live with it and work around it. So there's a few other things to think about. One is about about how stress affects different people, and particularly different groups. So traditionally, I mean, when I started in occupational health, we were doing executive medicals because the perception was that it's senior people who have stress and who have heart attacks, and that's who we should worry about. But actually, stress is a big issue for the frontline workforce because they have the demands, but they often don't have the control. And then managers, line managers, middle managers, professionals tend to get squeezed in the middle, so they've got a lot of issues as well. We'll be talking about mental stresses, and we know that mental stresses can cause ill health, but it's worth bearing in mind that physical stresses, physical issues can be stressful. So if you have an uncomfortable workplace, or you're in pain, or you're in a hazardous environment, then that's going to cause stress as well, which we need to think about. And the third thing to mention here is the fact that stresses are cumulative. And what I mean by that is you might have high demands, high workload, You might have an unhelpful manager. You might have a workplace that's poorly designed or uncomfortable. You might have lots of things going on at home with your family, and all of those add up. So you might handle one of them or two of them, but they all add together, and that's what starts to impact on your health. And in some ways, as organisations, that's quite useful, because if there's one or two things that cause stress that we can't do anything about, then at least we can address the others, and that reduces the overall impact. The other thing about stress is that they build up over time. So you can have a really high risk situation for a day or for a week, you're meeting a deadline, and that's okay. But if it goes on weeks, months, years, that's when it starts to impact on health. So what do we already know about mental health and work? There's loads of work that's been going on, some really good stuff about what it costs, what mental health in the workplace is costing. We know about the impact of work, and this very strong view that's coming out now that good work is good for health. And there's also been a couple of really good research projects in recent years that are specific to construction. So the one on the left at the bottom here is the CIOB, about understanding mental health in the built environment. And that was a survey of about 2,000 respondents responding about workplace stress. That was mostly professionals and managers, 95%. The other report there, the Institute for Employment Studies, which was done with Mates in Mind, that was looking specifically at self-employed workers. So that's mostly trades, manual workers, and about 300 people responded there. So we've got two really nice data sets there that tell us a bit more about what's going on. And you're probably aware of the 2020 report by Deloitte, and that confirmed that basically stress and poor mental health are incredibly expensive. So whether mental health problems are caused by work or not, it's really expensive. And if you can reduce it, if you can make any changes so that your workforce are less sick, if you're not contributing to that health burden, then that's got to be a benefit. The main thing I want to pick out from this slide is that you can see that the cost of absence from poor mental health is just under 7 billion, but presenteeism is 3-4 times as much as that. And that's difficult because absence, you can see what's going on, you know people are absent, but presenteeism is really under the radar. It's people just not working effectively because they're unwell. It's people low productivity, just increased safety risks, all those lower level things, and you can't see them, it's difficult to measure them, but they are having an impact. And if you've got a long supply chain, they're having an impact all the way down with people that you don't employ, but there is an impact. So it is really expensive. Just one update on this that I just picked up last week is they've updated the research post-COVID, and the cost of staff turnover has gone up massively. And that's because people are starting to say, actually, I'm not happy in this workplace. It makes me unhappy. It makes me stressed. It makes me miserable. I'm leaving. And there's big costs with that. So that, again, is worth bearing in mind. So what's actually going on in construction? What's the effect of work on mental health? The HSE data suggests that about 1% of the workforce have mental health issues related to their work in construction. Now, that's about half other industries. So on the face of it, that's not too bad, but I suspect there's quite a lot of underreporting there. That's the Labour Force Service survey. So the question people are asked is, how many illnesses have you had in the last 12 months that have been caused or made worse by work? If we look at some of the data from that CIOB report, we're looking closer to 40% of people who are saying that they're often stressed, often fatigued. And if we look at the Mates in Mind survey, again, that's late 30s, 40% who are saying that they've frequently got a very high workload or they're stressed by financial problems. And out of that cohort, 1/3 were measured as having severe anxiety and 1/3 moderate anxiety. So they're really high levels. Now, the problem with surveys is that the people who complete them are the ones who are interested. So typically there'll be people who've got more problems. So that might be a bit of an estimate. But the reality is that somewhere between those figures, there's definitely a lot of evidence that workplace is causing health problems in construction, and that's having an effect on work effectiveness and all sorts of things. So it's definitely a real issue. If you work in construction, it's not going to be a surprise that the things that managers and professionals are reporting is long hours, time pressures, poor planning, poor communication. And the frontline workforce are reporting workload, relationships, and they're also reporting physical stressors. So 64% of them saying they're getting stressed due to bullying, which that is a really disturbing figure. And just one other thing is that we're talking about the fact that stress can have an adverse effect on mental health, but don't forget that stress affects physical health as well. And this is really quite significant. So the short term, it's the headaches, tiredness, reduced protection from infection, all those things. The long term, working hours, so working greater than 55 hours a week, that increases your risk of stress and of heart disease and stroke. Chronic stress increases the risk of heart attack. If you've got heart disease or diabetes, then having a job where you've got low control and high demands increases your risk of dying from it. And then the other thing there is low socioeconomic status. So being poor or having low level of education, that reduces your life expectancy anyway, regardless of anything else. So the frontline workforce have really got a double whammy because they're already at that increased risk. So if there's workplace stresses, then that's going to affect them as well. So I'm hoping that I don't need to persuade you that it's a good idea to think about risk assessment. But if you do still need some persuasion, or if you need to persuade somebody else about it, then the financial benefits, you're talking a 5-to-1 cost effectiveness benefit. So you put £1 into managing mental health, particularly in preventative things, and that's going to give you £5 back in benefit. So it's really a cost-effective thing to approach. The other thing is it's the law, and it's been the law for ever such a long time. It's in the Health and Safety at Work Act. Management regulations, very clear. You need to make a suitable and sufficient assessment of the risks to health and safety. And that applies to mental health risks just as much as it does to physical health risks. And the management standards from the HSE have been given detailed guidance on this since 2004. So it's not new, but they've now put it in their strategy. It's #1 in their strategy for the next 10 years to reduce work-related ill health with a specific focus on mental health and stress. So they are looking at it. They are taking this seriously. Just one other point to mention on this slide is the person's not in his employment. So the management regs and the health and safety regs, Health and Safety Work Act, they're not just responsibilities from an employer to their employees. It's also anybody else. So if you're a contractor and you put risks through stress down the supply chain, that's going to fall under this. And if as a client, you're making decisions that create stress down your supply chain, again, that's going to fall under this. Just a bit more evidence that the HSE are taking this seriously. They have a stress e-bulletin every few months that says where they're up to. So since October last year, or since probably summer last year, their inspectors are asking about work-related stress. So if they're making visits, they're asking, are you managing stress? Have you done a risk assessment? Have you involved your employees in this? And then this one from the summer this year, the law requires employers to assess the potential risk from work-related stress and act on it. So if you need something that's words of one syllable, then that's it. That's really unequivocal that this needs doing. And then two last bits about why you need to do it. So International Standards Organization, BSI, they're also talking about it. So if you've got a management system that's ISO 45001 accredited, they're now saying 45003 goes with it. You need to think about how you're managing psychosocial risk. And that's quite a nice document. It's freely available. You can download it, and that's got lots of guidance in it. And then in the last couple of weeks, the World Health Organization's also in there. They've done guidance on mental health in the workplace. They've done a very substantial review of the literature, and they've said that stakeholders need to prevent exposures to mental health risks at work. So lots of people saying you need to do it. So that's your summary. If you need to persuade somebody that it makes financial sense, it's the law, It's worth thinking about reputation. If you're struggling to recruit people and there's a small workforce that you're recruiting from, if you can be the employer of choice because people know you treat your workforce well, that's a really useful thing. Obviously, there's high costs if you get prosecuted, if you have to defend yourself against the HSE or against a civil claim, that's going to be expensive. And there's the effect on your workforce in the short term, and in the long term, the health of the whole wider workforce. And there is a moral obligation, and it's up to you whether that's something that you think is useful to use in your workplace as an argument. So I've talked about why you do stress risk assessment. So how are you going to do it? It's really like any other hazard. You can use the same paperwork. So this is the HSE's template, but you might have one that you use in your organisation. It's just the same. Where it's different, I think, from other risks, there's two things that I think are relevant. It needs to be top down and it needs to be bottom up. And what I mean by that, to be top down, you need involvement from leadership teams, because the changes that you're going to recommend if you're looking at stress, they're things that are going to be outside your direct control. If you work in health and safety, you can't influence a lot of the things that need to happen. So you need commitment to do that. You need people on board. And ideally, you're going to have the whole of your senior management team committed before you get too far in. If you can't do that, at the least you need at least one senior person who's got some clout, because if you haven't got that, you're just going to fall at the first hurdle. But you also need to go bottom up. So whereas if you've got noise and dust, you can measure it, and that's evidence of what the problem is and how to deal with it. But with stress, you can't do that. You need to talk to the workforce, because their perception of what's the most distressing thing might be different from yours. So you need to talk to them. They might also have solutions and ideas as to how to address it. But what you don't want to do is to get the workforce involved, give them lots of ideas, make them think you're dealing with it, if you then hit a wall at the top. So that's why you need somebody on board first. So in terms of how you do that, if you are a small organisation, you're not very complex, you've got fairly generic workers and general risks that are the same for everybody, then it might be you could just do one workshop, one group of people, maybe if you've got an existing engagement forum or a group of health and safety representatives, and you have a discussion, you identify the risks, you prioritise, and you start to identify solutions. If you're going to go a bit further, you've got a more complex organisation, you've got a mix of people, then a survey is going to be a really useful thing to add to that. And I'll talk in a minute about what the different surveys are and how you might choose one. And then another thing you could do, and this is particularly useful in construction, where you might have a workforce who aren't particularly comfortable with paper-based surveys. They're going to be much more open and tell you things in discussions. So you can have focus groups, so 30 to 40 minutes with half a dozen people, just having an open discussion about what their main concerns are, and they might give you some ideas of solutions. And it can be useful if you're doing those, depends on your organisation, but to have somebody independent leading that, because the risk if you've got a small group of people talking to a manager or somebody from the organisation is either for them to feel reluctant to be honest, or for the person taking the feedback to become defensive and to say no, that's not true, or to argue against it. And another source of data is just any information you've already got. So if you've got information about accident, ill health data, sickness absence, exit interviews, audits, staff turnover, any of those things are going to be useful to help inform your risk assessment. So I said I'd talk about survey options. It's probably not a good idea just to write your own questions, because you're going to do much better if you've got ones that are validated. So what I mean by that is it's really difficult to write a question that gives you the answer you're expecting. So to make sure that people understand the question the same way you do and the answers you're getting are the right information, then a validated survey is going to give you that confidence. And benchmarking. So do you want to compare your organisation with other organisations? Are there other construction organisations, other organisations generally? And do you want to draw comparisons within the organisation? So do you want to compare different groups? Then again, that's something to think about in a survey. So the HSE management standards, I think, are always a good starting point. They've been around a long time. They focus on demands, control, support, relationships, change and job role. They also, as well as their survey, they have a talking toolkit, and that's just designed so that a small group of people with the manager or somebody else can have a discussion around each of those risk factors and identify what bothers them and identify possible solutions. So that's quite a nice tool, and that's specifically designed for construction. Some of the other surveys, you're probably aware of the Vitality Britain's Healthiest Workplace. Really good survey, very detailed, free to use. It gives you information to compare to other organisations, and you've also got individual responses to people within your workplace. The only downside of that is it runs once a year, and the closing date was about a week and a half ago. So if you were going to use that, you need to wait till next year. Mind have got their own survey, the Workplace Wellbeing Index. Again, you can benchmark with other people, lots of really good information. There is a cost associated with that. Good news is that that's running shortly, so you need to register by the middle of November to do this year's survey with them. And then What Works Wellbeing are an external organisation who gather data from academic research, pull it together to make it accessible more widely. And they've got a really good list of questions that you could use if you wanted to. Okay, so then another thing about stress risk assessment is how big you're going to do it. So if you've got a small organisation, straightforward organisation, or if you're only just starting this and you think it's going to be a bit tricky and you've got some resistance, then it might be that you want to do just one stress risk assessment for the whole organisation. And that's always a good starting point. Ideally, you're going to go a bit further than that and maybe think about job roles. So are the risks for your professionals different from the risks for your trades? Have your apprentices got particular challenges? Or maybe your site managers are a particularly stressed group. I did some research in a project a while ago, and the site managers described their experiences when they joined a job as, here's your laptop, here's your phone, crack on. So there were some really specific issues for that cohort around how they were inducted, and some really practical solutions that could be put in place. So you might think about job roles and break the organisation up that way. You might also think about breaking the organisation down by departments or sections, because maybe the stresses involved in building schools are different from the stresses involved in house building. So you might segment that way, or the stresses for your frontline workforce are different from those for your managers or your professionals or your HR team or your finance team. So you might break it down that way as well. You do need to be a bit careful, particularly if you've got a survey and you're starting to compare different groups, that you don't do detailed comparisons, because if you can do them, but you need to be really careful how you share that information, because it can come across as blame and, well, your risks are much higher than there and your stress is much higher than this other part of the organisation. So you need to be quite careful how you do that so that you don't start to undermine managers and make them defensive. And to me, the holy grail is to be doing stress risk assessment project by project, so that when you start a new project, right at the beginning, you're saying, what are the key stresses in this? How do we make decisions, and does that have an impact? If we decide to start a month early, if we decide to try and finish 6 months early, what is the impact on the workforce of that? Because that then starts to influence your decisions. And it also might mean that you can push back against the client if they're moving the goalposts. And it means the client can think about what their decisions are doing and what the impact is further down the supply chain. So just to remember, again, the point that the health and safety legislation gives you responsibilities for those who are not your employees. So that's really important. So stress risk assessment. who should be doing it. So really nice study a few years ago in IOSH. They asked about 800 IOSH members, who is doing stress risk assessment in your organisation? And basically only 30% of safety practitioners were involved in it. 64% of them were doing health promotion, only 30% involved in stress risk assessment. So I don't know whether that's that nobody was doing it or somebody else was doing it but not them. So we're going to just have a poll now. So Jenny's going to just open that to ask you the question, who do you think in your organisation is the best person to lead on stress risk assessment?
So for those of you on the call, you might see a poll box come up on your screen, which you can answer, or if you can't see it, you should see it in the chat box. So we'll just give you a minute just to answer those, and hopefully someone can see that. Wendy, you can't see it, so we're looking at the moment. So 40% of people are saying, oh, we've just got a bit of movement. Health and safety is coming out as the top, but it's fairly spread across all of them. So we've had 19 people respond, so I think we'll take that as most now. So Wendy, yeah, 35% saying health and safety. Oh, that's just moved up a little bit. 26% saying line manager, 11% OH, 19% HR. So yeah, pretty fairly split, but health and safety is the lead there.
Yeah. And I think the thing that's most important here is it doesn't necessarily matter who leads. The important thing is that somebody does, and that somebody takes ownership of this and pushes it forward. And yeah, occupational health are well placed because it's very much a health hazard that they're dealing with, and occupational health have that experience of dealing with difficult relationships and situations. But health and safety practitioners have really been picking up the health side of health and safety in recent years, so they're again very well placed to do it. And HR, a lot of the solutions fall within HR, things around working hours, about bullying and training and manager skill. So all of those can get involved and can lead it. The thing that's really important is who then owns that risk assessment. And what you can't have is that health and safety or occupational health or an external organisation like me and Jenny to actually say, we've done your risk assessment, here it is, off you go, put it in place. There's got to be collaboration. So it's got to be something that's produced in discussion with the line manager or whoever's going to implement it, and that they want to do it, they're engaged, they're motivated by it. And again, I've already said this, but it's so important. If you're sharing findings with somebody, then how you present those findings is so important, so that you're not saying, here you are, you've got this problem, you're doing this wrong. It's got to be collaborative, you've got to get them on side. So I've talked there, I'm aware I've talked very fast with a huge amount of information about stress risk assessment. So we've talked about why, how and who. And I'm going to hand it back to Jenny now to briefly talk about how to start identifying some of the possible solutions to problems.
Brilliant, thank you, Wendy. Well, I'd love to be able to sit here and put a slide up that says, right, these are all the solutions that you need to be able to solve stress. But as Wendy says, there are lots of different challenges we have, particularly within the construction industry, and unfortunately there isn't a list. I suppose the key thing to share is that this is about reducing the risk as low as reasonably practicable. And I know Wendy has mentioned this. We don't need to fix everything. You know, it's going to be impossible to completely eliminate all stress from everyone working in our industry and other industries. But it's what Wendy did say was it's about this cumulative nature of stress. So we need to fix what we can and reduce the impact of the rest. So we need to think about this over a longer term plan. And you think about safety, it took about 40 years to get the accident rates down by about 75%. And even then we knew what the cause and the effect was. So it's not going to be surprising if we have a similar process that we're going through with stress. And unfortunately, this is quite a busy slide because there's lots of links to some key resources. But as I mentioned at the start, we're going to send the slides out, so you'll have the opportunity to dive into some of these links. But there's three key things that I just wanted to draw some attention to, and probably these are things that have been quite exciting for me working in the industry in recent years, and hopefully hopefully I think something that could make a significant impact. So first one is time wise. So I actually know some people on the call, their organisations were involved with the research study that was done on this, but they've very helpfully now put together a 10-point plan, which is basically taking the learnings from the study and helping organisations say, right, what can we do to put flexible work into our own organisation? And I know there's still some construction companies that think this isn't a way that we can work in construction, but the research has been done and there's definitely ways to do that. Might not be exactly replicated by other industries, but there's opportunities to how we can improve flexibility. The second from last bullet point is about the Fairness, Inclusion and Respect programme, which is from the Supply Chain School. This is a programme that helps companies look at their culture and improve relationships for exactly that, fairness, inclusion and respect. I've seen the impact of this for some workforce on one of the projects that I work on, and actually the benefits from this and the impact was significant. And actually for me, after seeing the results of how that engagement had worked, I was really quite surprised and really helping promote what they're doing to other organisations. And the last thing, Project 13, some of you may have heard of this. I'm not going to pretend that I'm an expert on this, but interestingly, this is an industry-led response to the delivery models that we have in the infrastructure industry. So this looks at how, quite often clients have challenges, suppliers have challenges, and the delivery model that's set up means that it's actually really difficult for anyone to come out of this in a positive light. So they're looking at different business models which focus on enterprise rather than traditional transactional arrangements. And the thoughts are that it will boost certainty, boost productivity, and really help improve the whole life cycle of a project. So there are some of the rest of those slides out. Now, just to kind of finish up with where we are today, just want to do a little bit of a recap of what Wendy has said. So at its simplest form, this is about getting senior people on board, having a targeted group discussion and identify what the key hazards are and put that plan in place. Then reviewing this on a regular basis to see what the impact is. Now, if possible, we also need to try and get more information if we can. So this is talking to people, using survey data and trying to build that picture of what we have about the risk profile. The other thing just to reflect on, and Wendy has drawn on this a few times, is this is about looking at your own organisation and working out what the right pace for you is. If you're struggling to get people to buy into this, you might just need to start with a simple approach, and in that approach start building in, say, right, when we do the next review, we're going to engage more workers and gradually build on this each time we go. It's really important not to get loads of workers involved at this very, very early stage if you're not going to be able to get the senior support as you go through, because it's just going to undermine their trust in the process and really impact on you as you go forward. And again, what Wendy said, the ideal situation is looking at this really early on. So when you start a project, even if the clients are going to be proactive and start this and look at the risks that they're putting onto their contractors, really looking at the very early days and making sure that we can influence those decisions as we go down the line. So when we're talking about program pressures and demands, we know all these stories that we can relate to in our own projects that we've worked on. If we could get to that place, then hopefully we'd definitely see some improvements in how we manage stress and the impact on the workforce as we go forward. So just to kind of finish up with the slides from today. So this is, Wendy and I are here just sharing some of our information, and we want to talk about a little bit how perhaps we might be able to help you. So some of you might have listened to this webinar, and we know we've got some very competent people that have joined us today, and this might have just given you a little bit more confidence to take this on and manage it yourself. So hopefully our work could be done here. But if you are needing some support, or you prefer to have a third party to help give that impartiality, then from ourselves we could help from start to finish for this whole entire process or any of the stages throughout. The impartiality thing is quite an important thing, and particularly I know there's some OH professionals on the call, and when you're trying to build those strong relationships, and sharing some of these topics can be really challenging when you're dealing with line managers and senior management. So again, having a third party might help you there to be able to keep that relationship and have that third party deliver some of the news and work on the solutions. And finally, the other processes we might be able to help you with, if it's about getting your senior leadership on board, we can come and present to them about why it's important. help with your managers and coaching and train them, and those that are responsible for hopefully rolling out this process as we go forward. So if you want to get in touch with us after this and talk about your specific needs and challenges, then please get in touch. Okay, brilliant. So thank you, everyone. We have come to the end of the presentation. I'm going to stop recording now, and we are going to go to some questions.